Namaskaram. This is Dr. Rahul Nair. Today I am here to talk to you about a very important condition affecting our lungs. Have you heard of the term pranayama? Pranayama is a very important technique which is used by ancient Indian masters to control the life processes. Life, one of the important signs of life is breathing. We know that when the breath happens in a very unobstructed way, we feel very light, we feel effortless, we feel joyful. But something happens to our breath, it will directly affect the quality of our life. If you cannot breathe properly, if you cannot breathe in a way that your life processes are almost being affected, this is going to hamper the daily routine, and also this is going to put a question mark in your life. One such clinical condition that is going to affect you, affect the lungs, is interstitial lung disease. Interstitial lung disease, when I am speaking about this, I remember that in the past decade, when we were all studying about this particular group of diseases, it was much less, especially in the Indian scenario. But within one decade, we can see that the incidence and prevalence of interstitial lung disease is gradually on rise, especially in this post-COVID scenario. Many a time people come to us telling that there is dry cough for past 2 or 3 months, and also now there is a shortness of breath many a time, especially they might have noted it while climbing the stairs or walking a bit too fast, and later they have noted a very important point that this shortness of breath, this discomfort, a sort of panting, and also the dry cough is on rise. And slowly the patient is getting the feeling that even though he walks in level ground, even though he want to just move out of the room, from the drawing room even to the bedroom, he feels that there is a severe restriction of his breathing. So then the people approaches, gets into the investigations only to get a finding that this is nothing other than interstitial lung disease. So interstitial lung disease happens to be a heterogeneous group of disorders, almost 200 plus, that is having a very single clinical effect, that is destruction of the lung parenchyma. So, and the destruction of lung parenchyma, it's not happening in a single day, it happens inch by inch, or it happens day by day. What will be the output? Naturally, when the lung is getting destroyed, your breathing capacity, the vital capacity gradually reduces, and shortly we can see that because of this effect, the patient will be restricted in all the activities, and gradually it becomes a life-threatening illness. What causes interstitial lung disease? Mostly we can see that interstitial lung disease happens along with many of the autoimmune clinical conditions. For example, systemic sclerosis, rheumatoid arthritis, such clinical conditions which are having autoimmunity or our own antibodies working against us. In such a scenario, the people are getting this interstitial lung disease. In addition to that, we can see that people who are working for a long term in plastic companies, asbestos companies, and some other industries, all of them are prone to get this illness. Many a time we have noticed that a combination of cold climate along with the high air pollution is another important factor that triggers interstitial lung disease. Also, there are certain infections which happens especially in the pulmonological system that can also trigger this pathology of lung destruction. So all these set of factors are making you prone to interstitial lung disease. We can see that our air pollution rates are currently on a high, especially we all know that during the winters when the people burn something to get protection from the cold, that itself can create a lot of air pollution, and further it can affect many people who are prone to this illness. So is there a solution in Ayurveda? Whether Ayurveda is having another approach to this particular illness? This is the question in hand. We can see that Ayurveda approaches this in a very holistic, functional oriented way. Ayurveda is a science which is having its own designated pathological methodology wherein it approaches each disease not only as a particular organ failure, instead it connects this particular pathology that is happening in one particular organ with the whole body. So it's a whole system approach. So in this whole system approach, we used to consider the body and mind together. So when something happens to the body, equally the mind will be put into some sort of stress. And this mental stress can have a negative impact on the ongoing bodily pathology. So the right approach in Ayurveda, it tackles both the mind and body in almost all the clinical conditions. This happens to be a great advantage in management of interstitial lung disease. As we can see that interstitial lung disease, people are suspected to have continuous lung destruction. Ayurveda sees that every destructive process is associated with the doshas, Vata and Pitta. The doshas, Vata and Pitta, they are very dangerous, and many a time it is pointed out that they work like a combo of fire and wind. Fire destroys and the wind spreads that destruction. Likewise, in the field of lungs, the Pitta dosha will hamper the destruction. Pitta dosha will trigger the destruction, and the Vata dosha will spread the destruction. So an Ayurveda doctor is always on the look for Vata and Pitta dosha, and also the site of lungs are described as something which is having a predominance of Kapha dosha. So here the destruction is happening because of Vata and Pitta in the sphere of Kapha dosha. So we can see that this happens to be a very complex scenario where we are forced to manage the three doshas together. So for managing that, we are having a very specific protocol in which we need to stop the progression of illness first. Second, we need to reduce the symptoms of the patient so that his quality of life is regained. The third one is we need to prevent the further onslaught of illness. Fourth one, we need to stabilize the general life quality of the patient. So for all these purposes, initially when you consult an Ayurveda doctor, after having all those initial investigations are finished, and when you are being diagnosed as one among the many ILDs, for example, usual interstitial pneumonia or organizing pneumonia, non-specific interstitial pneumonia, likewise, many different diagnoses are possible. And with these diagnoses, when you approach an Ayurveda doctor, he will definitely make a whole system diagnosis in which your body and mind both are participated. And after making such a diagnosis, the doctor will make sure that he will make a quantitative approach in which an Ayurveda doctor can judge how badly the system is being affected and how this affection of the lung is being tormenting the person's quality of life. So after making that assessment and after identifying the real stage of the illness, the doctor will proceed initially with a Shamana protocol. The Shamana protocol is one in which the doctor initiates such medicines which will give symptomatic reduction in the patient's symptoms. So once the symptomatic reduction is achieved properly, the second step is to assess the strength of the patient, the physical strength of the patient, in order to find out whether the patient can endure the Panchakarma therapy. So the second phase is going to perform the Panchakarma therapy. The Panchakarma, as all of you, they are the 5 vital procedures which are actually bio-interventions. So these interventions can be done in a patient who is having certain level of physical endurance, and that can be judged by an Ayurveda doctor. And once the patient is fit for doing Panchakarma therapy, the process is initiated, in which initially the patient will be undergoing a procedure called Snehapanam, followed by a procedure called Virejanam. And after these procedures, when the patient's body is getting detoxified, the patient will be provided adequate rest to come back to a normal situation. And during this time, in order to increase the vital capacity of the lungs and also to subdue any mental stress, yoga protocols as well as pranayama will be initiated. And once the person is stabilized, the next step is to enter into the level of rasayana. Rasayana is a class of drugs which are very well explored by Ayurveda doctors, in which they select an appropriate rasayana drug so that the further progression of disease can be suitably arrested. So this three-phase treatment along with yoga and pranayama protocol can definitely bring a person's ongoing ILD process to a halt. But earlier the better. Once you are diagnosed as ILD, never waste your time. As early as possible, get in touch with an Ayurvedist and take appropriate Ayurvedic therapy. Along with that, one should be very careful about the food and lifestyle habits, especially those people who are in favor of taking three classes of foods. For example, the pro-inflammatory foods, which we term as abhishindi ahara, the mutually incompatible food items, which we term as viruddha ahara, as well as those food items which are very difficult to digest, we term it as vidahi ahara. So these three class of drugs, see, I am not going to give each and every food item a particular example. Other than that, I have described the nature of that food item. It can be pro-inflammatory, it can be incompatible, and the third one is difficult to digest. Such all items need to be avoided from the diet. The diet should be as light as possible, providing you much fresh energy, and it should be easy to digest. So such items shall be taken by the patient, and the patient should eat at appropriate time, especially the dinner. The dinner should happen at least 2 to 3 hours prior to sleep, and the patient should stop taking foods when he is not feeling proper appetite. And the food also always should be slightly warm, and it should be pleasing. So this type of food quality should be maintained by the patient. And the next very important thing is that the patient should be following a regular routine practice. The first one is of pranayama and yoga. The second one is patient should necessarily be in an aerobic exercise platform if the patient's general health permits. If the ILD is just find out, if the patient is able to walk, in that condition, he should sufficiently not over exercise. He should just have pleasant walking, especially a warm morning. Otherwise, getting into a sedentary posture always in a couch potato fashion will surely aggravate your disease process. But this advice is generally restricted to those people who are having much vital capacity, or rather they will be in the early phase of the disease. The other advice is regarding the sleep pattern. Those people in our observations having ILD who is having a regular sleep pattern will surely promote illness. So be very strict that you should hit the bed as early as possible and be an early riser too. So these protocols, along with proper Ayurvedic medications, yoga and pranayama support and Ayurveda treatment, will surely help the patient to slow down the process of interstitial lung disease, and thus to find more prana, more liveliness and more breath in the life. Thank you one and all.